practical strategies for connecting students to school-based healthcare. If you haven't already, we would love for you to let us know who you are and where you're joining from in the chat. We'll ask you to share your name, your organization, your state, and maybe a favorite autumn activity. A little bit of housekeeping before we start today. All attendees are in listen only mode. So we can broadcast to you, but we cannot hear what you're saying. So if you'd like to ask a question during the webinar today, you can use the Q&A function in your Zoom control panel, or you're welcome to use the chat box, as many of you have already done. If you'd like to use closed captioning, you can do that by clicking on the CC button on your Zoom control panel. We'll have a set of evaluation questions at the end of today's webinar. They'll pop up through Zoom. Those are helpful for us so that we know how we did and how we might adjust in the future. If you're using the chat, you may need to select the option to chat to everyone rather than just hosts and panelists, although it looks like a lot of people have figured it out. I'm Emily Baldy, and I'm so happy to be joined today by my colleague, Dr. Addie Van Zwal. We are at the School-Based Health Alliance, which is a national nonprofit that supports the work of school-based health centers. We do this by offering technical assistance to the field. We gather information about the great work that you all are doing so that we can tell your story. And we act as a convener. There are state affiliate school-based health alliances who do similar work in their own states. We bring that group together. We offer a national conference each year. Um, I mentioned that one of the things we do is technical assistance. One way we do that is through a cooperative agreement with the Bureau of Primary Healthcare, which is what's funding today's webinar. I am a social worker by training. I have worked with children and adolescents through my career. I live in New Jersey. That's my home state and where I have returned to. And much of my work here at the School-Based Health Alliance focuses on school-based health center startup, improvement, and expansion. And I'm so happy to see some names that I know in the attendee list. I'm so glad that you're here and hope that you'll feel welcome to share your insight and expertise in a couple moments when we get into the content. But Addie, would you share a little bit about yourself and your work?
Sure. Thank you so much. So as Emily said, I'm Addie Vanswell, and I'm a director here at the School-Based Health Alliance. I've been here for a little over 2 years, 2.5 years, working on three, and came directly from the School-Based Health Center field. So I worked in a School-Based Health Center just outside of Chicago for about 12 years. Recently moved back to my home state of Michigan, and have really focused a lot of my work on anything and everything related to mental and behavioral health for school-based health centers. I also support our food security work, and am now overseeing our consulting and Bureau of Primary Healthcare work. Pass it back to you, Emily.
Thanks, Addie. Our learning objectives for today, we hope that you'll be able to describe the connection between outreach to students and families and school-based health center sustainability. And perhaps more importantly, we hope you'll be able to identify at least 3 strategies for engaging with students, school staff, and families to get students connected to services. I want to acknowledge on this slide that many of you submitted great questions as part of the registration process. We reviewed them today, probably at 11 a.m. Eastern Time. Many of them were already in our content, some were not, and so we're going to plan to speak to some. Others of you asked about clinical services, delivery models, sustainability. We're likely not going to get to those questions today, but in a moment, I'll share some other learning opportunities where those questions might be more of a focus. We are offering a back to school fall learning series. It starts a week from today. It is 16 virtual sessions. They happen on Zoom, and they cover a wide range of school-based health center topics, including clinical services, I think we have like a innovations track, a partnerships track. So if you have some questions that didn't get answered today, you might take a look at those offerings. Addie, anything to add about fall series?
Nope. I guess the one thing that I'll add is that the presentations were from our annual conference that we had to cancel this year. And so we were able to take some of those abstracts and highlight those in another way. So we're super excited about that.
Thanks, Addie. The next opportunity that we'll share is one of my favorite projects that I get to work on here at the School Based Health Alliance. It's how I know some of you who are joining. We're offering a community of practice focused on school based health center success and sustainability. The community of practice includes 6 sessions that are facilitated by our team in partnership with some really wonderful health center leaders from the field, people coming with both clinical and operations expertise. The application process closes October 10th, and then sessions run November through February. If you have questions, please reach out if you're interested in joining, but not sure if it's a fit. I would love to talk with you more about it. The last opportunity that we'll mention that I don't think we have a slide for is that as an NTAP, so through that cooperative agreement with the Bureau of Primary Healthcare, we offer lots of webinars designed for health centers on a range of topics. So I know we had questions about vision services. We have some upcoming webinars on vision services. We had some questions about telehealth. We have some upcoming webinars on telehealth. We'll have a link to sign up for our digest at the end of the slides. And that's how we announce those webinars. I should also share that the webinar is being recorded and that we will share back with you the recording and the slides. This is our last call for you to check in. If you haven't already, we invite you to share your name, your organization, your state, and a favorite autumn activity. I've been taking quick looks at the chat, and it does look like we have a lot of pumpkin patch goers. So it's so good to hear how you like to spend your fall days. We are going to ask you to complete a quick Zoom poll to let us know where you're coming from in terms of your familiarity with school-based health centers. So we'll ask you, is there a school-based health center in your community? Maybe you work in a school-based health center. And then how familiar are you? Is this new to you? Are you still learning? Do you feel like you're a pro? Really helpful to see. Awesome. We'll give people another couple of moments. Nice. So it looks like most people are coming from a community that has a school-based health center. It looks like just over half of you work in a school-based health center. And then a real mix, although most people are somewhat familiar or very familiar with school-based health centers. So glad that that's our mix today because we're going to have lots of questions and invitations for each of you to share the practices that you're already doing because they might feel innovative or new or perspective changing to someone else. So we invite you to share with us about your work in the chat. Okay, I'm looking at the chat. I see more pumpkins. Love it. All right, let's get into the good stuff for today. If you have ever heard me talk about school-based health centers, you have probably heard me talk about this framework for excellence and sustainability. On the left-hand side of your screen is our core competencies. These are values, principles, things we ask school-based health centers to aspire to as they work to best serve the children and families in their community. And then on the right-hand side are the nuts and bolts, which are more practical, tactical practices school-based health centers can adopt to improve their ability to do their work in a high quality way over the long term. We might not be making super explicit connections throughout our conversation today, but for example, when we talk about connecting with school partners to ensure that they know what the school-based health center is and how it supports families. That could feel like collaborative school partnerships. It could feel like strong partnerships. When we talk about, gosh, does your child's pediatrician know that there's a school-based health center and how do they work together? That could feel like systems coordination. So just wanting to ground us in both the core competencies and the nuts and bolts. Some of the things we're going to talk about today. I will talk about regular meetings between the school-based health center and the school. I'll also talk about advisory committees and just touch very briefly on youth development strategies. And then Addie is going to talk about outreach ideas for different key players, as well as sharing school-based health center metrics. Let's start with some structures to support collaboration. I would love to hear, does your team have a regular time for the school staff and the school-based health center staff to meet? We meet every other Tuesday. We meet once a month. And if yes, what kinds of things do you discuss at that regular school-based health center meeting? Okay, I love it. Someone in the chat was brave and went first and said, not yet this school year. Yeah, someone else said, no, not regular meetings. I'm going to keep an eye on the chat. Some schools do, some schools don't. Yeah, we meet every month with our administrators. We have lots of schools, so we do email updates, staff presentations, cadence varies. Someone talks about staffing, rosters, and volume. Nice. Okay, so we're seeing a range of things once a month and talk about referrals, providers. Yep, regular emails, quarterly meetings. Nice. We are not necessarily going to suggest a particular cadence, but I love some of the things that people have shared in the chat. We discussed barriers to successful appointments, school needs, resources, student recall from class, school events. Awesome. Some things for you to consider if you don't yet have a regular meeting, or if you do, but you're thinking it could be more efficient and impactful. Consider including school-based health center staff, including clinicians. I know it can be really hard to pull clinicians from time that they could be seeing patients, and they might have a perspective that others on the team don't. So maybe consider including clinicians. And then who are the school staff that need to be part of this process? School nurses, school social workers, counselors, school psychologists. If you are in a community that's using a community school approach or strategy, your coordinators can be a great addition. Sometimes school administrators join these meetings as well. And then some of the things you might work on together, identifying opportunities to meet additional healthcare needs. I think in our work, this shows up a lot for dental services. Um, it may be that you work on planning upcoming outreach. I saw that someone in the chat put school events, and I wonder if they were talking about opportunities for the school-based health center staff to meet families. Someone talked about barriers to successful appointments that might be related to strengthening referral processes and workflows, clarifying roles and responsibilities, and modifying policies and procedures. Ideally, this is work that you were able to do at the start of your partnership, but things change, or a situation came up that you couldn't have anticipated, or you tried doing it in one way, but that didn't quite work. So, knowing that that continuous improvement is normal and to have a space to do that, I think both is good for the flow of your school based health center, but also I think is really good for relationships if we can address things as they come up. And then finally, I saw that someone shared in the chat that they talk about visit volume. Um, that's amazing. Addie probably is going to share more about this, but this meeting is also a time to assess your progress towards sustainability. Does the healthcare organization know, gosh, in order to keep the lights on or be sustainable, we hope to see about 10 visits a day. That number could vary, right? It's just a nice round number for the purposes of this conversation. And do your school partners know what that number is? And do they know how many students are consented? Do they know about how many visits your providers are seeing? We work with a team who does a really beautiful job of sharing this information monthly. They're not sharing PHI, it's just um, sort of aggregate numbers to help the school partners understand what's working and where they might work together to improve.
I think with that particular partner too, it's been really eye-opening for the school staff to say like, oh, like we really need this service in our school and they are only getting, 3 visits a day. And so what can we do differently as the school partner to say, okay, let's get up to those eight visits, those 10 visits, those 12 visits, whatever that final number is. I think we've seen a lot of improvement, I would say, in their numbers going up because the school also doesn't want to lose that resource. As you were talking to Emily, I was thinking about especially around clarifying roles and responsibilities. There's this idea, sometimes there's a lot of role confusion between behavioral health providers and school social workers. And so really making sure that you're having those conversations about those differences and how you can partner together. The school-based health center that I worked in, we had quite a lovely relationship with the school social workers, and it was never about, there were always enough students to be seen. So it really wasn't a competition. It was really how can our roles complement each other and how can we work best together to best serve the students early on and as time progresses, right? Like I started in 1 year and I was still there 10 years later. And guess what? School social workers changed over time. So as our staffing changes, as the school's staffing changes, having those ongoing conversations around roles and responsibilities, I think is really helpful.
I love that, Addie. Yeah. And I think to that point about that group that we work with who does this monthly report out around sustainability, I think there's also this tie in around identifying opportunities to meet additional health needs. Um, Dental days for this team, they have a mobile dental unit. That has been really great for relationships with families, for helping kids stay in school, and also for them as they work towards sustainability. Similarly, their model allows for them to serve parents and families. Again, important for sustainability, but equally as important, that was a need that their school partners helped them identify. So, encourage you to consider a regular meeting if you don't have one already. Mm, I see a question in the chat about pointing out we have low patient appointments. Others may have insight. I would love to see what others say in the chat. And I wonder if one piece of that is just what Addie said. Does this service feel important to us as a community? And if yes, how does each partner understand their role in getting families connected? Is it that there is a need that we're still not meeting? And if yes, what are the different relationship and outreach levers that we might push? But I appreciate that question, and I'm hopeful that others will also share some insights and experience in the chat. We'll also ask you to share, do you have an advisory committee or a similar group? So this would be a group that is bigger than just your school and your healthcare org. It might include families, it might include community members, it might include students. Great. We have a committee. We reported on quality measures, number of visits, enrollment numbers, number of cavities and sealants. Awesome. Yes, I love it. So not only do you have a committee, but you share information back with them. I'm going to advance to the next slide, but encourage you to share in the chat if you also have an advisory committee. If you don't have one and you think that it could be valuable for your work, your advisory committee might include someone from the health sponsor, the healthcare org, school staff, students, family members. You might include other pediatric healthcare providers in the community, youth serving organizations, and community members, faith leaders, business leaders. Some of the things this group might do. They might facilitate informal communication. This can also be an opportunity for the advisory committee members to let the school-based health center know, gosh, we heard that you're only open 2 days a week. And maybe the school-based health center is open 4 or 5 days a week. That's really good information to have so that you can ensure that people know what's available to them. They might work on vision and mission. They
think she froze, but I'll jump right back in. So, looking at the vision and mission of the sponsoring organization and how that may or may not align. Hopefully, it aligns with the school. Allowing there to be some input around services, how they're marketed. I remember talking with families and saying, hey, we have the school-based health center, and they're like, we had no idea it existed, and we had no idea you were here. And I was like, oh, really? Because we've been here for the last 20 years. And they're like, I had no idea, right? So, really getting their input in terms of how to better market your services, I think can be really helpful. Um, Welcome back, Emily. I
So
was chiming in
fun.
on the marketing piece.
You're the best. Thank you. Can you see my screen okay?
Yes,
Thank you. Did we get to feedback?
that's where I left off.
Thank you. All right. We encourage school-based health centers to collect feedback. It may be that you do a survey to students and families, maybe that you do focus groups with school staff. We actually have seen that go really well. Your advisory committee can be part of that process. They might seek funder relationships, and they can help you as you both evaluate existing services and plan for future expansion. Last but not least on my end is how does your school-based health center engage students, either in planning or in implementation? While folks put their answers in the chat, I'll share some thoughts from our end. There are opportunities to include young people from the planning all the way through the maintenance phase. Um, Planning, startup, expansion, ongoing. There are lots of ways that school-based health centers do this work. Tabling at lunch, attending sports planning meetings, nice. Let's see what else is in the chat. Health fairs and tabling, review of marketing materials, and we have an internship. This sounds so great. Would you share more in the chat about your internship? I love this. So yeah, these are great examples. The first one that we often highlight is a youth advisory council. This is typically a group that's convened by the school-based health center. Some youth advisory councils focus more heavily on outreach, marketing, feedback related to the school-based health center. Others might focus both on the school-based health center and on health topics. We've worked with youth advisory councils that have done some healthy relationship promotion activities in February. We worked with a team in the Southwest where their youth advisory council was doing some activities for Skin Health Month. So it can look a lot of different ways. It may be that you have young people on your advisory committee. Maybe you invite them to give feedback on services, experience, maybe marketing materials, as we heard in the chat. They can do outreach and enrollment, peer education and mentoring. It may be that as you look at expansion, they are part of the process of mapping your assets and needs. And then again, as someone shared in the chat, there may be opportunities for internships, career pathways. Nice. We have highlighted some youth-centered approaches. We often share this in conjunction with a couple of other slides. And the one piece that I want to be sure to include is that we encourage you to think about opportunities that are grounded in meeting the young person's needs and helping them move towards the things that feel important to them. So like definitely an opportunity for us to learn how to revise our marketing materials so that they resonate more, but more importantly, what is that young person's goal and how does their participation in this process help them get closer to that goal? Addie, is there anything you want to share?
I think one thing here, and maybe it's obvious, but really, youth are at the center of our work. And if we're not involving them, or at least not asking for informal feedback. I think that's, something to really just kind of emphasize that even if you don't have the capacity to have a full on youth advisory council, we would love to have everyone at every school-based health center, right? But sometimes that might not be a thing that you can do right away. But if there are little ways that they can contribute in a meaningful way, both for your health center and for them, I think that's a really great opportunity. I remember I worked with a group of youth who really wanted to highlight mental health awareness week, and we put on different kind of presentations and different opportunities, and it was completely youth driven. So they came up with all the ideas. They came up with they said, I want to share my story, or they said, I want to go into the cafeteria and provide information on mental health services. We did a panel. Like, it was 100% youth driven. And then they were like, let's invite some health classes, let's do this, let's do that. And so I supported as the adult, but really it was them who were driving kind of the different activities that we had that week. So I think that's a really good example of how to do something that's, yes, impactful for the school-based health center, but even more so for the students, and for the students who got to, see the panel, or talk with their peers in the cafeteria. That's just one small example.
Thanks, Addie. Yeah, and other really lovely examples shared in the chat as well. I'm gonna turn it over to Addie.
Yeah.
I did see a question about elementary school and youth advisory council. That's such a good question, and I am going to write down your name right now, and I am gonna connect with our colleagues who lead our youth development work at the School-Based Health Alliance, because they might have some neat examples. I am less familiar. Yes, to the person who's hopping, there will be a recording. So I'm gonna take down your name and we'll follow up. Thanks for that question.
And I think when I think of the elementary schools, some of the things that I have heard is sometimes involving the older kiddos in the elementary school building. I think, third, fourth, fifth graders, maybe closer to the fifth grade range. But there is, I think, some capacity to really invite them into having some conversations. But yeah, I think we have some really great colleagues who work more closely with youth advisory councils, so we can follow up with that. So we're going to shift gears slightly. I feel like we've talked about this a little bit, but we're going to talk about outreach to families, students, and school staff. So I will give some examples, but would also love to hear from you guys. So for our first question, what is one strategy your team uses to reach out to parents or guardians to help them understand what the school-based health center is and how it can support their child or children? School newsletter, love that. Table it back to school, emails, texts, welcome back events, back to school. See lots of tabling events. Perfect. So keep them coming. Um, so some of the ways that we kind of frame this or talk about how parents and guardians know about their school-based health centers, is from two different components, right? So there's the side of like building the relationships, but there's also that marketing piece. So if we start on the school staff side of things, I think it's incredibly important. I also remember some school staff saying, like, school-based health center, like, what do you mean? I don't know you existed. I also worked in a very large building, to be fair, but there were some teachers that didn't really know what our school-based health center offered. And that wasn't because we haven't told the whole school staff. It's just it maybe wasn't landing, or maybe they didn't read the email, or maybe they were out the day that we went to present to school staff. And so the more that you can educate your school staff around the services that are available to the parents, the better. So making sure your school nurse is very involved, having your front office staff, your administrators, anybody who could really have kind of that high parent contact. Teachers, you're gonna want to make sure that they at least know the basics about the school-based health center. I think word of mouth is probably one of the biggest things in terms of learning about the services that you offer. Pediatricians. So I think this is a really great way if you have relationships with your local pediatrician offices and that they're able to refer back to say, hey, did you know that if Emily, needs to go see a doctor during the day, there is a school-based health center and they are able to go there, right? So, having the pediatricians, in the area be aware of your services. There might be some direct outreach. So you may have different rosters where you're reaching out to parents yourself, saying, I noticed your child hasn't had a well care visit in X amount of years. We would love to do that for you. Here's the consent form, all of those good things. And as many people have mentioned in the chat, being present at school events. So I can't tell you how many basketball games and football games I personally was at, just to really kind of build and strengthen those relationships. In terms of marketing, I think there's a lot of different options here, but I think having the information accessible on the school's website is incredibly helpful, especially when they are trying to figure out like what services you may offer. If you have a direct link, or maybe it's housed on the school base or on the school site itself. Um, I think what's also helpful, or we have seen helpful, is to make consent forms available online. So whether that's if there's an electronic version of that consent, amazing. If not, even just having the consent forms available that parents can print and return to the school. Having signage, so making sure you're very visible. So, having signs in the school so people know where you are, where they can find you. Um, Having information about your school-based health center included in the registration packet. I think this is a really easy and good way to get kids signed up for the school-based health center. It's sometimes I feel like parents are signing them up for school, and then if they see that school-based health center consent, they just continue on with filling that out. And I think that's a really great awareness for them to know that you are available in the school. And then there's kind of the other more traditional, like social media, TV, print. I know we've posted flyers in the community, in some of the different community organizations, libraries, community centers, that kind
I've
of
seen
thing.
billboards.
Oh, that's awesome. That's great. Anything else you want to add, Emily?
I wonder, is this a time when we want to talk? We got a question about what some of this outreach work might look like if you're using a mobile school-based health center. And not that the outreach is just to parents, but do you want to talk a little bit about some unique considerations for mobile now?
Sure. Yeah. So I think when we're talking about mobile, I think it's really important that when you're doing kind of marketing and outreach, that you're very clear about when and where you'll be. I think that's one of the biggest challenges with mobile, sometimes, is that people don't always know where the mobile van is that day. And so making sure that that's very well documented, whether that's on a website or that's with, if people call to say, hey, I want to get my child in, and they're not at your child's school, but they may be at the school down the street, to be able to say, like, hey, you can't see them today, but they are down at, you know, Abbott Elementary, right? Like that you'll be able to kind of point them in the right direction. I also think it's important that you're clear around like who can access the services. So is it just the students at that school? Do you also accept siblings, community members, that kind of thing? Um, is there anything else I'm missing, Emily?
I don't think missing, but I do also think about the importance of, and I believe that there are some school staff on the call today, so glad you're here. For mobile units, the importance of really having strong relationships with school staff, right? That child needs to get from the school building to the mobile unit. Because the mobile unit is likely not there every day, it may be that that process of reaching out to parents, particularly it may be parents that the school nurse knows that they have had trouble getting in to see their primary care provider, or maybe that child doesn't yet have a medical home for the school nurse to do outreach to those families. And then once families are enrolled in the school based health center, as Addie mentioned, and as some of you mentioned in the chat, for the school based health center staff to do outreach around things like well child visits. So I think that the relationship piece in some ways maybe becomes even more important when you're doing work from a mobile unit.
Great. Thank you.
I saw a question in the chat about um, starting a school-based health center, and I'll put in a plug. We can share it and follow up. We did a webinar around the same time last year that was focused on school-based health center startup, where we had some panelists from the field who were great. So if you're interested in startup, we can share that webinar in follow-up.
I also noticed that Patty, you had your hand up. Curious if you could put your question in the chat. I think that would really be helpful for us. So as we move forward, we're curious if you guys have some strategies that you use to connect with students to let them know about the school-based health center and how it can help them. So any ideas, or how do you let students know that you are there to support them? So far I am seeing presentation to health classes, tour from incoming ninth graders on day one, um, freshman classes for overview of services. That's great. Emails, texts, push-ins. Love that. So I think one of my favorite stories is when I was not the type of provider who could sit in my office for very long periods of time. And so I was always like active in like, I probably got a lot of steps in when I was working in the school-based health center, because I would go into the cafeteria, I would go to in-school suspension, I would go up and down the many flights of stairs that were in our building. But the one example that I like to give is that I was walking through a cafeteria one day, and I had this young lady who quite literally screamed my name across the cafeteria as I was minding my own business. I was actually looking for another student, but all I hear from like clear across the room is Miss V, Miss V, and I'm like, what is she like? What does she want? And it was one of my students, and I went up to her and I said, "Hey, like, what's going on?" And she's like, "Oh, I just wanted to say hi." And then there was a little bit of chatter at the table. And her friends were like, "Who is this lady? Like, why are you trying to get her attention?" And the young lady had said, "Oh, well, that's my anger management teacher. Like, you have some anger management issues too, so maybe you should go see her. She's really good." So that word of mouth is really quite valuable when it comes to the young people. And interestingly enough, the young lady's friend did end up coming to see me a couple days later, and then became one of my regulars as well. So I do think that word of mouth is really helpful. Especially, I saw another comment in the chat um, around being present in the hallway during the school day, just to kind of build that relationship. Youth advisory councils, I think we've talked about that quite a bit. Having adolescent friendly posters, I love that. School staff. So again, I think coming back to making sure your school staff know. I mentioned earlier how I worked pretty closely with the school social workers. So they would often say, if they were meeting with a student that they thought needed therapy, they would call me. And then when I come into the office, they would say, like, "Hey, this is my friend. I think you should talk to her," and like make it a very, um, very like warm handoff, and not to say like, oh, you're gonna go talk to her and never talk to me again, but it was more of a, hey, this is another adult that I trust in the building, and I think she could be really helpful in working through your depression or your anxiety or whatever was going on with the student. And so being able to have not only those warm handoffs in the clinic, but also being able to have those warm handoffs with different school staff. I also would often be called by the deans or the school counselors to say, like, hey, I don't really want to suspend this kid. Can you provide some sort of intervention? And the answer was always yes, because I didn't want them suspended either. So I also worked really closely with the coaches, mostly around school physicals. So, like, as the social worker, I was still very much promoting all of the services. So, not just behavioral health, but also, hey, we can do all your school sports physicals. We can follow up on any sports injuries, like all of that kind of thing. So, I got really close with the coaches. And they would often seek me out to say, like, hey, can we get this kid in? They have to play tonight. And so really it all goes back to those relationships. I think we also, you guys have mentioned already, kind of that visibility piece, and being present at schools. And then marketing, again, I think kids see things on the walls and they see things on social media. So making sure that we are marketing and showing our services through the means that they will actually see it, right? So I think this is where our student voice can um, really be helpful. Um, the school nurse questions. So there's a question about connecting with school nurses at different schools. Um, and I think it's really having the buy-in piece is all about relationships, I think, and just having conversations with the school nurses, talking to them about how your services complement but do not replace their services, right? Um, I think sometimes there can, when there's not a lot of understanding of the different roles, sometimes people may feel like we're there to replace them. We are not there to replace them at all. That's not our role. We're there to support, and we're there to um, keep kids in school and keep them healthy and keep them safe. So we work very closely with school staff. Next slide, I think, unless you have something else to add, Emily.
No, I'm excited about this next topic, but nothing else for me on that one.
Okay. So this next one is related to connecting with school staff to offer information about the school-based health center. So, what are some ways that your team does this? How do you connect with school staff?
I saw professional development in the chat earlier, which is a great option. Mhm.
Well, seeing staff meetings, counseling. Um, what you're probably noticing is a lot of these outreach strategies are quite similar. Even though we have different audiences, we're still relying on relationships. I don't think I can emphasize that enough. That relationships are really the foundation of what we do in school health centers. Um, Making sure that you're scheduling those meetings with those school staff to educate them about services, being available for school events. I think there was a question about how schools can promote school-based health centers in a way that doesn't feel like a burden to the school staff. And I think right there is really just figuring out um, how you can arm them with all of the tools and all the things they need. So whether it's a consent form or a flyer or a 101 fact, right? So it's not that we're trying to add more work to the school staff, but we're really trying to make sure that students, families, and staff know what the school health center can do. Um,
I
I
also love, Addie, I know we talked about this in preparing. I love the example. We visited a school-based health center, so great. And they had worked with the person who does attendance at the school. They're at a K-8 school, and together they wrote up a script so that when that person calls home, they can let parents and guardians know if your child missed school today because they're sick, they're welcome to call this number and make an appointment to be seen at the school-based health center. And so I think one, just what an effective strategy for informing parents, but two, giving that person a script so that they don't have to figure out like when do I say this and what do I say. So what are the opportunities that the healthcare org has to either collaboratively develop or give some messaging to school staff to ease that burden on them a little bit?
Mhm. It's a great example. Another thing that I did when I was working in a school-based health center was we had some funding that was available to do like a teacher lunch and learn. So kind of around those professional development ideas where I would bring a mental health related topic. I would bring some food and I would gather a bunch of staff. And it was a really great way to not only build those relationships with the students, but also provide the staff with a little bit of PD on whatever topic that was, in addition to them understanding kind of the role of the school-based health center. And so sometimes what I would see just anecdotally would those teachers would reach out to me and say, "Hey, I noticed that Emily was really struggling in class today. Do you think you can check on her?" Or they would say, "Hey, I think my entire classroom has strep throat. Can you can you guys please do some strep cultures to see what's going on?" And so, we wouldn't take a class field trip, but those were ways to kind of strengthen those relationships with the teachers. Having tours, I think sometimes staff may know that the school-based health center is there, but maybe they haven't really seen it, or they know like where it is in the building. They maybe walked by, but they haven't actually seen the exam rooms. So being able to provide those tours. Um, and then partnering with teachers, I did this all the time where I would go into the health classrooms. I would go into special ed classrooms and really do some either co-present and or be a guest presenter, to kind of build those relationships. um,
One other thought I'm having as I'm looking at the chat, I love hearing so many of you say that we go to professional development, we go to staff meetings to educate the staff about the school-based health center. I also think that there may be opportunities for school-based health center staff to learn from their school colleagues. Thinking about that relationship building piece. Do you have a sense of how your school nurse spends their days? Do you know what kinds of things they see? Do you know like what their flow is like? I think that yes, absolutely, to helping your school staff learn about the school-based health center. And are there opportunities for you to learn from them so that you can better support the kids that you all care so deeply about? So I think it's a two-way street in terms of learning and sharing.
right. Love that. Just for sake of time, we do need to continue to roll here. So how do you know if it's working? So some things that we have suggested is looking at kind of even printing your consent forms off at different events. So that way you can see like how many returned consent forms you get based on whatever event that you had attended. You could collaborate with your school partners to evaluate which efforts were most effective. So, um, just really kind of having those open conversations of like, hey, we tried all of these things, which ones were the most effective? Having that advisory committee feedback, so allowing for them to contribute to the conversation, and then really looking at kind of the regular kind of enrollment utilization. You'll know if your appointments are going up, if your utilization, if your percentage of consent forms is rising. So that is a really great way to kind of check and see if the outreach is working.
Someone shared with us that it seemed like Some comments maybe were only shared to hosts and panelists, which is probably my fault. We had some tech challenges and I wonder if the chat reset. So if you'd like to share with everyone, please make sure to select everyone when you chat. But I think we tried to surface lots of the ideas that you all shared in the chat in our conversation. Thanks for letting us know.
All right, so kind of back to the idea around metrics. So these are just some of the kind of key metrics that we have found helpful when sharing with school partners. So knowing, sometimes we all know like school health centers may be open or may not be open depending on the school days. So it's helpful to kind of know those exact service days, especially I'm thinking about our mobile considerations too of like how many days were you actually at each school. I think that could be really helpful. Um, there are also having kind of those number of students that are enrolled in the school-based health center. I think that can be really helpful and eye-opening for school staff to know about unique patients. So, and being able to divide that by like students, staff, and community, if you are open to the community, I think that's sometimes helpful. I know one of the partners we work with, they divide it up in this way, and it's really helpful to say, like, oh, the teachers at this building are really utilizing the school based health center, whereas at this other building, they're not so much. And thinking about it, are there different outreach strategies that they could use to increase those staff visits? Most common reasons for visits, progress on the quality measures. So we do on our website have some quality measures that are out there around like depression screening and well child visits and that kind of thing. And so really tracking those. Insurance coverage and then program revenue and expenses. So not the necessarily the nitty gritty details of the budget, but just kind of having the overarching understanding I think has been really helpful in the school-based health centers that we in education partners that we have worked with. So, with all of that being said, we talked a lot about just different ideas, different strategies. We are hoping that you will share with us one collaboration or outreach strategy that you would like to try after today's webinar. It can be big, it can be small. Would love to hear from you guys.
And Addie, maybe as those people who want to share in the chat, we had a couple questions actually about if you are newly starting a school-based health center, what are some of the most impactful and best ways to let people know what's available, generate excitement? Do you want to go first, or do you want me to share some thoughts?
You can go ahead.
Okay. Um, We worked with a team that was in this situation, and they really committed, probably for the first 6 months, to being at so many school events. Sometimes it was the providers, sometimes it was other staff. And at first, sometimes things felt slow. They ended up doing some evaluation after, just kind of like what were people's impressions. But I think being as present as you can be, and ideally, the people that will be front facing, right? So the people that will answer the phone when a mom calls. I think that can be really valuable. I also think if you have the opportunity, if the calendar works out, the school based health center is not open, but maybe you're able to schedule a handful of sports physicals days. You can work with your school colleagues to advertise, to get the paperwork completed for those. That can be a great way for families to meet and see the provider, to know what's coming, and to meet a really important need. So, as much time to be present at things like football games as possible. And then, if you have the opportunity to do some of those clinical days before you start services, I think that can be pretty impactful as well. Addie, other things on your mind?
Feel like we've talked about a lot of them, but I think just kind of anything you can do um, to build the relationships and just have conversations with the staff in the school. I think I was very fortunate to be very well integrated into my school, and sometimes I even had to remind them that I was not a school staff member. Um, but I think I was able to really build some of those relationships. And anytime we had a new staff member, I would always bring them around and be like, "You need to meet so and so and so and so," and just really making sure that even if your role doesn't allow you to leave the health center walls all the time, I do encourage you to just really get out there, meet the staff, see what you can do to be a support. Because the more that you have that trusting relationship with the school staff, I think the better it is for the students and the families that we serve. And it really helps with kind of the warm handoffs and really getting families connected.
I think I'm gonna launch the Zoom poll, right, Addie?
Yeah.
Okay.
So if you
Hmm.
could take the next couple minutes, let's see. Do you have it, Emily, or you want me to launch it?
It looks like I do not have it.
Okay, let me launch
Have
it.
it?
Hopefully
It's
this
the
is the
second one.
one.
Yes. Thank
All
you.
right. So if you could take a couple moments to respond to our Zoom poll, we would greatly appreciate it. And we would love for you to stay connected with us. So there are many ways you can do so. So if you scan the QR code, that will bring you to our website where you can subscribe to our digest, which goes out bi-weekly. I definitely encourage you to sign up if you're not enrolled already. We also have several social media handles, so Facebook, Twitter, Instagram, LinkedIn, where we also share a lot of our events on that. So definitely stay connected with us. And I think that's a wrap. We really thank you guys for being here and for being so engaged in the chat. I know we didn't get to all the questions, and we're sorry for that. An hour always seems to just go by so very quickly. But we really appreciate you being here and engaging, and hope to see you again soon.
Thanks for your time today. We'll follow up with the slides, the recording, as well as information about some upcoming learning opportunities. So good to be with you. Thank you.